Potassium deficiency is more dangerous than calcium deficiency. Mrs. Park Mi-young, South Korea, 60 years old, has been suffering from high blood pressure for 10 years. She had to take medicine and adjust her habits in his daily life to prevent the disease from recurring at the highest level. Recently, Mrs. Park feels tired often, even when she has enough time to rest. Sometimes, there are unexplained heart symptoms. One day, during a meal, Mrs. Park had severe hand tremors and could not even hold chopsticks. Her family urgently took her to the hospital to check. After checking, her discomfort was not due to myocardial infarction but due to hypokalemia. The cause of potassium deficiency has a lot to do with the blood pressure medication that Mrs. Park has been taking for a long time. In this regard, the family finds it difficult to understand why taking antihypertensive drugs can cause hypokalemia. Why is potassium deficiency caused by taking antihypertensive drugs? We know that there are two types of antihypertensive drugs commonly used in clinical practice, namely diuretics and autonomic nervous system drugs. One of the side effects of diuretics is a potassium deficiency. Diuretics lower blood pressure by inhibiting sodium and water reabsorption, reducing blood volume, thereby reducing blood supply to the heart and lowering blood pressure. Potassium in our body will be eliminated by excretion, so the patient is easy to be deficient in potassium. In particular, some patients need to take doses greater than or equal to 2 times per day, which will make the body more potassium deficient, and the risk of hypokalemia in these groups is also increased. And this is the reason why Mrs. Park has hypokalemia, even though she only has high blood pressure. We know that calcium deficiency can lead to osteoporosis, while potassium deficiency harms the whole body. When the body is deficient in potassium, many patients will have symptoms of weakness in the limbs, then abnormal kidney function and respiratory muscles. In some serious cases, it can lead to paralysis of the limbs. In addition, a lack of potassium will reduce the contractility of the heart muscle, causing the patient to have arrhythmias. Some patients with chronic potassium deficiency will also cause kidney problems. The patient will have a dysfunction of urine concentration, which will then cause symptoms such as polyuria and hematuria. Not only that, potassium deficiency can also affect the normal function of the gastrointestinal tract, causing patients to have symptoms such as loss of appetite, nausea, vomiting, severe intestinal paralysis. In addition, potassium deficiency can also cause disorders of the central nervous system of the patient. 4 signs of potassium deficiency. Number 1. Tired. The storage of glycogen in the liver and muscles will be affected by the amount of potassium. If the amount of potassium in the body is too low, the transmission of nerve impulses and electrical signals will be affected, and brain function will also be abnormal. You'll be prone to depression and headaches. Number 2. Irregular heartbeat. If you don't exercise vigorously and you find your heart rate increases abnormally fast, you should be on the lookout. This can be a signal of the body's lack of potassium. The lack of potassium will cause the heart and lungs to be stimulated at a high rate, which will cause some abnormal activities. Tachycardia is one of the common phenomena. Number 3. Leg cramps. When calves cramp, most people's first thought is calcium deficiency. In fact, not all cramps are caused by calcium deficiency. Potassium is also one of the key nutrients for maintaining normal muscle function. When the body does not have enough potassium, calf cramps often occur during daily exercise. Number 4. Unstable blood pressure. Potassium deficiency is not a direct cause of hypertension, but for hypertensive patients, potassium deficiency will have a very bad effect on disease control.